There were a number of comments and several questions submitted related to the Affordable Care Act and the Community Health Needs Assessment mandated by the Act. And this slide is simply a reminder that the Section 9007 of the Patient Protection and Affordable Care Act requires nonprofit hospitals to conduct community health needs assessments at least once every 3 years and to adopt an implementation strategy to meet the community health needs identified through such assessment in order to maintain their tax-exempt status. And the assessment must take into account input from persons who represent the broad interests of the community served by the hospital facility, including those with special knowledge of or expertise in public health, and be made widely available to the public. In order to implement that portion of the Act, the Internal Revenue Service has issued a notice of proposed rulemaking, which is shown on this slide, or at least the reference to it, which is called the Community Health Needs Assessment for Charitable Hospitals. It was issued on the 20th of May 2013, and it's available at the URL listed here. You can go there for the most recent information on the implementation of this portion of the Affordable Care Act. Here are some of the comments and questions made during the Module 1. Just wanted to quickly go over them. First of all, again, the ACA mandates the Community Health Needs Assessment every 3 years by nonprofit hospitals. Students asked if there were any penalties for conducting the Community Health Needs Assessment, for not conducting it. And the answer is yes. There is a $50,000 excise tax each year that the assessment is not conducted. Are hospitals required to show a specific amount of improvement on measures in their improvement plan? No, they're not, but, and quoting from the regulations, these proposed regulations require the implementation strategy to describe, in addition to the actions the hospital facility intends to take to address the health need, the anticipated impact of these actions and the plan to evaluate such impact. So there does have to be some attention paid to what specific actions are going to be taken by the hospital facilities and what the impact of those actions are anticipated to be. There also needs to be an evaluation plan. Does the ACA require a standard measurement strategy with a tailored set of measures? No. If no, would such a strategy and measures be useful? Well, it's a good question. What do you think? What don't you think about that one? Finally, are the CHNAs conducted to meet ACA requirements available? Yes. When they are done, they must be conspicuously posted on a website that is readily available to the public, and this is for all of the hospital facilities that in fact conduct such needs assessments. The next 3 slides provide some specific information from the proposed rulemaking concerning the implementation of the Community Health Needs Assessment portion of the Affordable Care Act. One item on this slide is that the hospital facilities actually have to define the community that they serve and assess the needs of that community. That's how defining the community is addressed. The next section talks about the way in which the community can be defined, and the proposed rules provide some flexibility in that, but they do talk about geographic area that's served by the hospital, target population served, and if the hospital has particular functions, for example, focusing on a particular specialty area or targeted disease, they can help define the community of people with those diseases, for example, that are likely to be seen by the facility. And how must the community needs themselves be assessed? And this particular section talks about how that needs to be done. And the hospital facility must identify significant health needs of the community and prioritize those health needs. There needs to be input from the community and in particular from public health. And there's a section in the proposed rulemaking on who the hospital facility must consult, and it includes one state, local, tribal, or regional public health department, two members of the medically underserved, low-income, and minority populations in the community, and three, they have to take into consideration written comments that are received at the hospital facility on the most recently conducted community health needs assessment and implementation strategy. So this is a slide with some questions. I hope that some of the things I just went over address some of them. I actually cannot answer why we are holding nonprofits to doing assessments and letting the others go without them. Presumably in the background and history of the Affordable Care Act itself, this issue may have been addressed. I just don't know the answer to that. The second question is, how can for-profit hospitals and other for-profit healthcare facilities be held responsible? Well, that's a good question. Again, that's not an issue in the ACA because they are not being held responsible. In fact, I guess the student here may have been making that as an argument why they might not be included in this. And what makes us believe hospitals and communities will do these things and do them well? And I have gone over the kinds of needs assessment that has to be done, things to be included in the implementation strategy, and that there has to be a method for evaluating the implementation of the actions taken under the implementation strategy produced by the hospital facilities.